So today we're just going to talk about how we use ultrasound, but not all ultrasound, just ultrasound for neuro-op. So ultrasound has a lot of utility in terms of intraocular tumors and looking for orbital disease. But in neuro-op, we really are using ultrasound in very defined ways. The first is when we're looking at the optic nerve head, if we see drusen, ultrasound is a very good way of detecting calcified drusen. So if we have a patient who has pseudopapilledema, the ultrasound will show the hyperechoic calcium inside the disc head itself. And in addition to looking for drusen, we can look for fluid in the optic nerve sheath. And the fluid in the optic nerve sheath can be squeezed out of the eye by moving the eye. So normally the optic nerve is like a little bit S-shaped like this. And so when we go from the primary position to extremes of gaze, it kind of pushes the fluid in the sheath out of the sheath. And so we can measure the diameter of the optic nerve sheath, nerve complex in primary and 30 degrees off of primary. And that 30-degree test can tell us if the fluid is in the sheath. And so we have ultrasound for looking for calcified drusen and for looking for fluid in the sheath, which is pseudopapilledema versus true papilledema. The other way that we have been using the ultrasound is for the temporal artery. So in the temporal artery, we normally would do a temporal artery biopsy. And what we're looking for in the temporal artery biopsy is the internal elastic lamina is disrupted, and that leads to inflammation, lymphocytic infiltration, thickening of the wall, and the narrowing of the lumen. And because there's white cells and a multinucleated giant cell, pathology specimens of the temporal artery can show active temporal arteritis. But ultrasound is also able to see the same things. The ultrasound can see the narrowing of the lumen, and the ultrasound can see the ultrasonographic equivalent of the lymphocytic infiltrate, because we can see a halo, and that halo sign is what we're looking for in giant cell arteritis when we're doing ultrasounds of the temporal artery. We're looking for that halo of hyperintense, hyperechoic against hypoechoic white cells inside the lumen of the vessel, and the narrowing of the lumen. So the halo sign can be used for temporal arteritis. And then finally, we can use it for looking at the muscles. So when we were looking at the muscles, we're looking for myositis. And because the resolution of ultrasound is better than CAT scan, it can show us thickening of the muscles. And the most common cause of big muscles, as you know, in adults is thyroid eye disease. But if it's just one muscle, or if it's eye pain, or it's only one side, then we're looking for myositis. So enlargement of the muscles can be seen on ultrasound of the orbit. Ultrasound is a really great way of looking at the eye and the orbit because it's very close to the surface. And we're using sound waves instead of x-rays or light to make the signal. And in neuro-op, our most prominent indications are pseudopapilledema from calcified drusen, fluid in the sheath to look for evidence of increased intracranial pressure radiographically or ultrasonography, and the halo sign in giant cell arteritis, as well as myositis.